Hello, I'm Lauren Haldeman, Editor-in-Chief of the Journal of Nutrition Education and Behavior, where we are advancing research, practice, and policy. And each month we select an article to feature as a press release with an accompanying podcast. And this is a particularly exciting podcast because today's article is part of the 50th anniversary of WIC special issue. And this article can be read in full at www.jneb.org for free for the next 3 months. And today I'm really excited to be speaking with Dr. Leslie Hodges, who's the corresponding author for the article titled Less Engagement with WIC in Early Infancy Predicts Early Exits from the Program. Again, I'm glad to have you with us today. Leslie, can you tell us a little bit about yourself?
Yeah, for sure. Thank you so much, Lauren. So, again, my name is Leslie Hodges. I'm a research agricultural economist at USDA's Economic Research Service. And I'm really interested in how federal assistance programs help families make ends meet and how they support their health and well-being. So at ERS, my main area of research and focus is the Special Supplemental Nutrition Program for Women, Infants, and Children, better known as WIC.
Great. Thanks so much. So let's get into it. Can you tell us a little bit about the paper, a brief overview, and some of the key findings?
Absolutely. So, for any listeners who might be unfamiliar with WIC, it's one of USDA's major nutrition assistance programs. And its focus is on promoting the health of pregnant and postpartum women, of infants, and children up to the age of 5 who are low income and nutritionally at risk. And the main purpose of our study was to examine factors associated with early exits from WIC. That means at or before the child was about 13 months old. So children who meet WIC's eligibility guidelines, they can receive benefits up until the time that they're age 5. But a lot of families stop participating in the program before that with a pretty steep drop off around age 1. So for this study, we used data from the WIC Infant and Toddler Feeding Practices Study 2 and multivariable regression analysis to develop a well-fitted model predicting early exits from WIC. And for this model, we really wanted to incorporate measures of maternal engagement with WIC early on in the postpartum period, so in the first 5 months after birth. These measures included things like the mother's knowledge of the WIC program and how it works, whether the mother received nutrition education and breastfeeding support, and then the mother's perceived value of the WIC food package and nutrition education. And we ultimately found that mothers who didn't receive information from WIC about breastfeeding and mothers who did not report turning to WIC as an important information source on infant feeding, they had a higher likelihood of an early exit from the program. So our study also confirmed findings from prior studies around the underuse of WIC food benefits and also later enrollment in WIC, such as later in pregnancy or even in the postpartum period, being associated with early exits from the program.
Thanks very much, Leslie. It's a very salient topic, certainly, right now. And can you talk a little bit about what motivated you to examine this issue now? And were there specific key questions that really led to this work?
So we really developed this paper from both pragmatic and methodological motivations, and we were delighted about the 50th anniversary special issue. But programmatically, WIC has been undertaking a lot of modernization initiatives, really aimed at increasing program participation, program retention, and then full use of the WIC food package benefits. And so I had, said that age 1 is a pretty steep drop off in participation. And so we were hoping to help inform these initiatives by looking at associations between early exits from WIC and then those aspects of maternal engagement with WIC early after birth. And we really wanted to focus on factors that maybe previous studies had not considered. And again, our main thinking was that this could inform policymakers and program agencies on potential ways to promote retention. And then methodologically, we really wanted to design a robust model predicting continued participation in WIC that we could use in future studies to help address selection bias. Selection is a major barrier to understanding WIC program impacts. So this study really digs into the prior literature and this really rich data available in the infant toddler feeding practices study too, to just develop this model to predict early exits from WIC that we then used actually in a follow-up study that was just published in the American Journal of Preventive Medicine, where we used the model from the study and we created inverse probability of treatment weights, and we examined how longer participation in WIC is related to children's diet quality at 5 years of age.
Great. Thank you. And when you're thinking about the implications of this work, who would most benefit from really understanding what you found in the study?
Well, so the main takeaway from our study is that, for participants who initially enroll in WIC, practices that promote early engagement with WIC, that maybe reach WIC participants with breastfeeding information and lead them to look at WIC as a valuable source of infant feeding information may promote retention. So at ERS, our aim is to provide high quality objective analysis so that policymakers and program administrators that they can make informed program decisions. WIC program staff and nutrition educators, they likely know the importance of engagement at early ages and stages. But when it comes to informing program decisions, it's really beneficial to have empirical findings that confirm or support what program staff may already know. So our findings come from a nationally representative sample, and analysis on this scale really helps to reduce uncertainty about whether observations that program staff may see firsthand, like something like mothers who are unclear about how the program operates are less likely to continue to enroll their children in the program. If we find evidence that these, patterns are systematic, then that suggests that programmatic or policy changes could potentially affect them.
Thank you very much. You have widespread implications for the findings of this work. And you did mention it a little bit already, but do you have plans to publish more in this area?
Yeah, so I mentioned that Karina and I have published a follow-up study where we use the model that we develop in this study to estimate the impacts of longer participation in WIC on children's diet quality at age 5. And that study is open access and it's available from the American Journal of Preventive Medicine. And then at ERS, we're always working to produce research on issues relevant to food and nutrition assistance programs, food access, food markets, food prices, and the rural economy. We just released several WIC-related reports that may be of interest to listeners. One is on measures of WIC access or measuring WIC participation among the eligible population. Another is on WIC participant access to WIC authorized vendors, as well as their access to both mobile and fixed broadband internet, to kind of consider how that might support use of WIC modernizations and maybe promote online shopping with WIC. And so listeners can head to our website, ers.usda.gov, to check out those reports. They can also get updates on new research released by ERS by signing up for email notifications at the bottom of our homepage.
Sounds like there's a wealth of good information out there on this topic, and I'm looking forward to continued work in this area. I really appreciate you spending this time with me, Leslie, and for being a contributor for the 50th anniversary WIC special issue. I've really enjoyed reading this work and seeing it also compiled in an issue that's got wonderful work from so many different authors. So I appreciate that. Is there anything else that you'd like to mention about this work?
Yes, definitely. One thing that I would add is that we also considered maternal mental health as a factor in early exits from WIC. And I think there's been growing attention to issues around maternal mental health and also how they might create challenges around navigating things like certification and recertification for programs, especially in the postpartum period when moms are navigating a lot of other things as well. So our findings suggest that there may be more to explore there. I would also note that this research just would not have been possible without the high quality longitudinal data on WIC participants. So the ITF PS2 is a longitudinal study. It was conducted by USDA Food and Nutrition Administration together with WestStat, and they followed mothers and their children from enrollment in the study and enrollment in WIC all the way up till the children were 9 years of age. So it's actually pretty incredible. And they followed the children, mothers and children, regardless of whether they continued to participate in WIC. And that was really important because it allows us to look, at differences between children who participated in WIC for longer and those who left the program early. So that's this really fantastic resource to study the WIC program. Former USDA staff Kelly Scanlon and Courtney Policelli, they played a huge role in making the data publicly available, and the WestStat team did an incredible job with data collection, their reports, and as well as providing the information for other researchers to use the data. So I really hope more researchers will use it. I also want to say that this would not have been possible without my amazing colleagues and collaborators on this work. So that includes Joanne Guthrie, who recently retired from ERS, Karina Laura. She is a professor at George Washington University. She's also the chair of the WIC Learning Collaborative. Kaylee Ryan Claytor, she is a postdoctoral fellow at the University of Michigan, who also was a Pathways intern at ERS. And then Amanda Reed, who is at the Food and Nutrition Administration, she was one of the project officers on the study, and her insights into which variables we should consider and why were just invaluable. So we definitely couldn't have done this work without her.
You've had quite an impressive team working on this.
They're fantastic. Yeah.
I can tell. Well, again, thanks so much for spending this time with me. And to all of our listeners, remember, you can read this article in full in our special issue on the 50th anniversary of the WIC program at www.jneb.org for free for the next 3 months.